Coming up next, we're going to talk about inflammation of the artery, an inflammation called giant cell arteritis that could lead to blindness. We'll be right back.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex De Jesus.
Dr. De Jesus is an expert in treating people with arthritic and arthritic type conditions. Alex, we're talking about something that could cause a headache. It starts with a headache, but could lead to blindness. What are we talking about?
You know, this condition is called giant cell arteritis. So patients may hear arthritis, but this is arteritis from the word artery. This is an inflammatory disease of the blood vessels. This is not a good disease to have.
So what's happened in that condition?
In that condition, we think that's an autoimmune disease. The immune system has been stimulated probably by a virus, and now it's attacking the blood vessels that are all going inside the brain and the ones that give circulation to the brain. Now, here in this illustration, we see...
Let me interrupt you. What's happening to the blood vessels?
The blood vessels are becoming swollen, and so now they're going to become thinner, smaller, and they're going to clot.
Okay.
And the circulation stops.
And what are we talking about? What part of the body?
We're talking about the blood vessels that go inside the brain. Now, that starts at the carotid artery in the neck, but we're lucky enough that one of those branches is superficial, goes to the scalp to the temporal region, and that's
right
why...
on the side of the head.
Right on the side of the head, right there where you're showing, and that's why we call it temporal arteritis. But it's not just there. The other blood vessels are swollen too.
What are the symptoms?
The symptoms are going to be headache, a severe headache. This is not like a headache that you've had before. It's very severe. It's a headache that's going to put you down. And the other symptom really interesting.
Where's the headache located?
The headache is going to be right where that temporal artery is, right there.
You can feel the pulse, right?
You can feel the pulse. If the pulse disappears, that's not good. It means that there's clotting going on in there. And then the other symptom is a severe stiffness of the neck, the shoulders, and the hips. It's called polymyalgia rheumatica. And those patients, they're like tin men. They cannot move. And interesting enough, you can throw all the pain pills you want at this, and nothing happens until you treat it with a steroid.
Talking about treatment, how do you make a diagnosis?
The diagnosis is going to make with those symptoms that we have, and then this artery is long enough that you can take a biopsy, and then the pathologist is going to tell you giant cell arteritis. And then sometimes you need to biopsy both sides because it's patchy. It doesn't include the whole artery.
So they go in and take a little piece of it out, look under the microscope, and the cells look bigger than normal.
Very big, and there's a lot of immune reaction going on. It's very typical. The diagnosis on the biopsy will not be difficult to make.
But the treatment has to be fast, or you could end up with blindness, right? I mean, it's irreversible.
Definitely blind or strokes, because it happens because the other arteries that are inside the brain that go into the eye are also inflamed with this condition. So all those arteries are being involved. It's not just this outer artery.
And how are you going to treat this condition?
This patient is going to be excellent if you treat him with a steroid. It's going to be a prednisone or similar steroid, and they should have less symptoms pretty fast. They go into remission, their symptoms go away, the artery shrinks, and many times you can cure the disease. That means that later on someday, the patient's going to be off the medication.
Can it come back?
It can come back or be partially treated. You know, you tell the patients, take this one a day for 30 days, and they take it every other day, or NuFull, or they stop too early, the condition can come back.
Well, I think the other thing to be important is that, you know, we're talking about a lot of people have headaches, but you don't want them to think that they can all get blindness. So what age does this happen? Who's at risk here? This
is not a condition of younglings, of 20, 30-year-old, mostly people over the age of 65. Female more than male. For some reason, the European, Scandinavian people get this more than we do, but it doesn't matter here. We don't have a lot of those people. We still see a lot of these cases. And funny enough, there's sort of a seasonal increase with this. So from October, November through the cool months, we're going to see much more of this than the other months.
How often do you see it? In a year, how many patients do you think you see with this?
Of this condition, 4 or 5 patients a year.
So it's not that common.
This is very rare.
But it's very devastating if you get it.
And the patients can dramatically do well. So this is the kind of a disease that you treat, and the patient within a week, they're significantly better, much better.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.